In the last 20 years, the World Health Organization has helped to immunize more than 2 billion children against polio. Yet the disease still exists in Afghanistan, Pakistan, India and Nigeria, with Nigeria accounting for more than 50% of new cases. VOA's Brian Padden visited the northern Nigerian state of Kano, where polio is common.
When Mohammed Adamu was only a year old, he developed a high fever and was later diagnosed with polio. He now has weakened muscles and paralysis in his legs. His mother, Mariam Hajia, says it is difficult to accept that her 5-year-old son's condition is permanent.
I am really disturbed and worried over the present situation of my child, a polio survivor now.
Mohammed Adamu is one of a growing number of children with polio in Kano. In the nearby village of Gazawa, 9 children have the disease. Last year, Nigeria reported more than 790 cases, the largest outbreak of polio in the world. Open sewers and poor sanitary conditions are conducive for the polio virus, but many parents in northern Nigeria also refuse to immunize their children. The World Health Organization attributes the increased cases in northern Nigeria to an earlier decision by authorities in the heavily Muslim region to boycott the polio immunization program.
In 2004, rumors and allegations spread throughout the northern Nigeria state of Kano that the polio vaccine contained birth control drugs as part of a secret Western plot to reduce population growth in the Muslim world.
While the boycott lasted only 11 months and the Kano government now supports immunization efforts, doubts about the vaccine linger. Gazawa village chief Ibrahim Maman explains why local leaders rejected immunization efforts.
We stopped cooperating with the immunization people because of fear the vaccine contained birth control.
Local leaders are now organizing public meetings like this one in the village of Gawo to educate local communities about the disease and the vaccine. VOA health reporter Sani Malumfashi produced a short documentary on polio that is shown at these gatherings. The documentary incorporates dramatizations, medical information, and testimonials by political and religious leaders.
The main motive of doing the documentary and a drama program is to bridge communication gap, to correct the misinformation, give the ordinary people the correct information for them to make an informed decision regarding taking polio vaccine as the only option.
At the end of this education session, Malum Fashi asked the villagers if they would now cooperate with the polio immunization program. The response was overwhelmingly positive. But Dr. Lola Mabumguje with Compass, a Nigerian health education organization, says the Nigerian government must go beyond encouraging compliance and compel all Nigerians to immunize their children.
We don't have a carrot and stick method for if I don't do this, what happens to me? No, it's not in place. It is not yet in place, and until that is generalized in this country, we may not move anywhere on immunization.
Without forced compliance, she says, polio will continue to afflict Nigeria and potentially spread beyond its borders. Brian Padden, VOA News, Kano, Nigeria.
Malaria is a serious disease in Africa, killing a child every 30 seconds. Mosquitoes carry the parasite and infect people with their bites. But when people sleep under bed nets, they can reduce the risk, and there are new malaria treatments. But in many African communities, there are no doctors and nurses, and few healthcare centers to store and distribute the supplies. That's where community volunteers come in. Cleophas Bakari is treating his neighbors. He's distributing ivermectin, a drug which can prevent river blindness. He carefully measures the height of each member of the family to make sure he gives them the right dose. But Cleophas is not a doctor. In fact, he's only completed secondary school. He's a health volunteer.
It was announced that communities should select somebody from the community to be in charge of distributing ivermectin. A meeting was held with all the community members, and my name was put forward as someone who would be fit for the job.
Cleophas is one of thousands of community volunteers who were part of an earlier study to distribute the drug that prevents river blindness. It was so successful, it spawned another study by TDR, the Special Program for Research and Training in Tropical Diseases, to put in place 4 additional health interventions to see how many issues could be handled by volunteers and how complicated they could be.
My responsibilities include the distribution of ivermectin, the distribution of vitamin A, the malaria drug Coartem, and I'm also responsible for the distribution of bed nets.
The study was done in Nigeria, Uganda, and Cameroon and covered more than 2 million people. The biggest improvement came in malaria care, which doubled the treatment coverage across the study sites. The number of bed nets being used also went up. The African Program for Onchocerciasis Control will now use what has been learned to expand the program to many more sites throughout Africa. The community drug distributors cannot replace doctors and nurses, but this approach is proving that communities can manage simple but life-saving health interventions themselves.